Hi, my name is Aisha Lubega, and I'm doing my presentation on cultural competence teaching case study. The scenario which I chose to do my case study was on SJ, who came to the clinic for a blood sugar that was getting out of control. His hemoglobin A1C was drawn and was found to be 7.0. Well, we found that he wasn't abiding by his dietary regimen and he wasn't exercising. And on top of that, he wasn't checking his blood sugar on a regular basis. SJ falls into the developmental category of the middle age or the baby boomer. And although we see that these individuals can be well versed in their understanding and learning processes, they also suffer from some midlife crises. Some of the cultural considerations that need to be placed in the scenario are very important to his care. SJ happens to be a recent immigrant from Haiti, and due to the fact that he's not accustomed to the culture in the US, it is very important to consider some cultural aspects which might influence his care. One of the basic things that we do every day in the healthcare system is communication. And it's very important to understand the different cultures that we might be taken care of in the hospital environment or a clinic or any other healthcare setting. When we regard into the Haitian culture, we have to understand that sometimes they may not maintain eye contact when speaking with people of authority. This doesn't necessarily interpret into not listening or not caring. It might be more of a sign of respect. It's important to ask family members to assist with interpretation only if an interpreter is not available. It's important because Haitians are very private and it would be inappropriate to share their information. The use of touch is a way to make sure that you're aware that they are speaking to you. So do not take offense to a casual touch on the arm or the shoulder. Some of the family roles which are played out in the Haitian culture are that the man is usually the head of the family. But often today, most families are matriarchal. Women are generally expected to be honest, respectable, and faithful. Children are expected to be respectful and obedient, and they're also expected to be high achievers. It is important to include family members in the care of the loved ones in order to achieve a level of trusting relationships and compliance with the treatment regimens. Some of the health practices which are followed are the fact that good health is viewed as the ability to achieve a balance between chill and fray. And this translates into hot and cold. Promoting good health requires being strong, having a good color, being plump, and being pain-free. Balance requires eating well, having good hygiene, praying, and having good spiritual habits. Illness can sometimes be perceived as punishment or considered an assault on the body, which may have two different causes: natural illnesses or supernatural illnesses. Some of the nutritional cues which should be considered is the fact that they prefer to eat at home and they discourage fast food. So it is appropriate and recommendable to ask family members to bring food for them into the healthcare environment. There is an emphasis on hot and cold, acid and non-acid, heavy and light when discussing food. Again, this is one of the important emphases on keeping a balance, and not doing so is going to result in illness. Sometimes eating properly could even mean eating to the point of being full and maintaining a constant body weight. And weight loss can be seen as one of the most important signs of illness. Some of the high-risk health behaviors of the culture: alcohol plays an important role in society, mostly culturally approved for men. Cigarette smoking is practiced by men, and women have a very low rate of tobacco use. Some of the other high-risk behaviors which could be viewed are the non-use of seatbelts and helmets when driving or using a motorcycle or bicycle. Usually these safety measures are not used in Haiti. Some of the beliefs are very important to people of this culture. There's a belief in the power of the supernatural, which can have a great influence on the psychological and medical concerns of the client. The extended family is a great source of strength to most in this culture, and it is important to recognize and accept clients' beliefs in order to alleviate the barriers and make clients more at ease to discuss their beliefs and needs. Some of the death and spiritual beliefs that are practiced are um, a form of spirituality, which involves Catholic religious beliefs combined with Buddhism, which traces its roots in Africa. Buddhism involves a communication by trance between the believer, the ancestors, saints, or animistic deities. And believers in Buddhism attribute some of the ailments or medical problems to the doings of evil spirits. Are there any questions? This is no way is inclusive of the cultural aspects which we have to look at when taking care of a patient of this culture. There are variations between different people and depending on how they were brought up. But I'd like to thank you for watching my presentation. Thank you.